Indigenous men and boys face many barriers and challenges in accessing mental health services and support. Some of these barriers are historical trauma and intergenerational effects. Indigenous people have experienced colonization, displacement, residential schools, cultural genocide, racism, and discrimination for centuries. These traumatic events have impacted their mental health and well-being, as well as their sense of identity and belonging. The effects of these traumas are passed down from generation to generation, creating cycles of violence, abuse, poverty, and substance use. Lack of culturally appropriate and safe services. Many Indigenous people do not feel comfortable or welcome in mainstream mental health services that do not respect or understand their culture, values, traditions, and worldviews. They may also face stigma, stereotypes, and prejudice from healthcare providers who are not trained or educated in Indigenous ways of healing and wellness. Indigenous people may prefer to access services that are delivered by Indigenous providers or that incorporate Indigenous knowledge, practices, and languages. Geographic isolation and limited resources. Many Indigenous communities are located in remote or rural areas that have limited or no access to mental health services and support. They may have to travel long distances or relocate to urban centers to receive care, which can be costly, stressful, and disruptive to their family and community ties. They may also face challenges such as lack of transportation, internet access, phone coverage, or housing options. Gender roles and expectations. Indigenous men and boys may face additional pressures and challenges related to their gender roles and expectations in their communities and society. They may be expected to be strong, stoic, resilient, and independent, which can prevent them from seeking help or expressing their emotions. They may also face discrimination or violence based on their sexual orientation or gender identity, especially if they identify as LGBTQ2S, lesbian, gay, bisexual, trans, queer, or two-spirit. Indigenous men and boys face many challenges that affect their mental health and well-being, such as historical trauma, discrimination, poverty, violence, substance abuse, and loss of culture and identity. These factors contribute to the high rates of suicide among Indigenous communities in North America and elsewhere. Suicide is not only a personal tragedy, but also a collective one that impacts the whole community and future generations. Therefore, it is crucial to adopt culturally appropriate and community-based approaches to suicide prevention and mental health promotion for Indigenous men and boys. These approaches recognize the importance of culture, spirituality, history, and relationships and understanding in addressing the root causes of suicide and mental distress. They also empower Indigenous communities to take charge of their own healing and wellness, using their strengths, values, and traditions. Some examples of culturally appropriate and community-based approaches to suicide prevention and mental health promotion for Indigenous men and boys are: increasing the availability and accessibility of Indigenous community mental health workers who can provide culturally responsive care and connect clients to other resources and services. Developing suicide prevention programs that are informed by Indigenous knowledge, worldviews, and healing practices, and that involve elders, families, and community members. Supporting Indigenous men and boys to reconnect with their culture, language, land, and spirituality through activities such as ceremonies, storytelling, hunting, fishing, drumming, dancing, and art. Creating safe spaces for Indigenous men and boys to share their feelings, experiences, and challenges with each other, and with positive role models who can offer guidance, support, and mentorship. Promoting positive masculinity among Indigenous men and boys that values respect, responsibility, compassion, courage, honesty, humility, and wisdom. These are some of the ways that we can break the cycle of mental health stigma for Indigenous men and boys and help them thrive in their lives. By honoring their culture and identity, we can also honor their dignity and humanity. Thank you for watching this video, and please share it with others who may benefit from it.